An MRI explained the scan that maps you with a magnet, not radiation. Your doctor says you need an MRI, and two thoughts usually arrive together: that long, narrow tunnel and the loud banging everyone warns you about. Then the report comes back, dense with words like disc bulge, signal change, and small lesion, and your stomach drops. But here's what most people miss: an MRI is not a verdict on your body, it's a window into it. And almost every line on that page is your doctor being thorough, not your body being in trouble. So let's walk through it together calmly: what an MRI can see, what it can't, and when it's truly worth having. So what is an MRI actually doing? Here's the first surprise. There is no radiation at all. No X-rays. An MRI is a very large, very strong magnet paired with radio waves, the same harmless kind that carry music to your radio. That tunnel you slide into isn't a camera. It is the magnet itself, wrapped all the way around you, which is exactly why, before you go in, you're asked so carefully about any metal in your body, because that magnet you see is always on. So how do a magnet and a little radio turn into a picture of your knee or your brain? It starts with water, and you are mostly water. Inside every drop sits hydrogen, and each one behaves like a tiny spinning compass needle. Slide into the scanner, and that huge magnet gently lines them all up. A quick pulse of radio waves then tips them, and as they swing back into line, they hum a faint signal of their own. The scanner listens, and a computer turns that quiet hum into astonishingly detailed slices of your soft tissue. The famous banging is just the machine switching smaller magnets to mark where each signal came from. It all takes time. So the one thing it asks of you is to lie beautifully still. And this is where an MRI is simply unmatched. Where an X-ray sees bone, an MRI sees the soft things in exquisite detail: the brain and the spinal cord, the nerves, the knee and the shoulder, a torn ligament, worn cartilage, a slipped disc pressing on a nerve, the soft organs deep in the belly. It can trace the exact edge of a tumor, reveal the telltale patches of a disease like multiple sclerosis, and in the first hours of certain strokes, see the damage clearly when a CT scan might still look normal. For the soft architecture of the body, nothing else comes close. So, is an MRI simply better than a CT scan? No. And this is worth holding on to. They are partners, not rivals, each brilliant at different things. ACT is fast and superb for bone, for sudden bleeding, the lungs, and for an emergency, when minutes matter. An MRI is slow, but unrivaled for soft tissue and fine detail, with no radiation at all. So when your doctor chooses between them, it isn't about which machine is fancier. It's about which one answers your question. So why does this matter, especially here in India? An MRI is one of the more expensive scans you can have. The machines are far fewer and often far away. The wait can be long, and for most families, it's paid out of pocket. So when a glossy, full-body MRI screening package is offered to a perfectly healthy person, it's worth a careful pause. Because, as we're about to see, a scan this detailed will almost always find something. And for someone with no symptoms, that's a problem, not a reassurance. And this is the part that saves the most needless worry. An MRI is so exquisitely detailed that in almost anyone, it finds something. Take ordinary back pain. Among people with no back pain whatsoever, bulging discs are remarkably common, and they climb steadily with age. By middle age, a great many of us, completely pain-free, are walking around with a disc bulge or two and feel completely fine. The same is true of small bright spots on a brain scan or a harmless cyst. So a scan that reads abnormal is very often just a normal, well-lived-in body, which leads to the single most important idea in this whole video. A finding is not a diagnosis. What a scan shows only matters when it lines up with how you actually feel. Now, because that magnet never switches off, metal genuinely matters, and this is the one part to take seriously. Before your scan, you'll be asked more than once about anything metal inside you: a pacemaker, certain implants or surgical clips, or even a tiny fragment in the eye for those who worked with metal. Please don't brush these questions off. They exist to keep you completely safe. The reassuring news: most modern implants and joint replacements are made MRI safe, and many pacemakers now are too. And even an older device is rarely a flat no. It usually just means a careful, case-by-case plan with your cardiology and radiology team, never an automatic refusal. As for the scan itself, it is loud, so you'll wear headphones or earplugs, and you need to stay still. And if the closed-in tunnel makes you uneasy, you are far from alone. Just say so. A few calming words, sometimes a mild medicine, or a more open scanner can make all the difference. Some MRI scans also use a dye given through a small needle in your arm to make certain tissues light up. But note this carefully. It is not the iodine dye used in a CT scan. It's a completely different substance called gadolinium. For the vast majority of people, it is very safe. There are just two sensible cautions. If your kidneys are significantly weak, your doctor will weigh it up carefully, since it's cleared by the kidneys. Though today's newer dyes are far safer than the ones that caused concern years ago. And in pregnancy, this dye is usually avoided unless it's truly necessary. You may also have heard worries about tiny traces lingering in the body. With the dyes used today, there is no evidence of harm in people with normal kidneys. But it's a perfectly fair thing to ask about. No fear, just the why. An MRI is one of the quiet marvels of modern medicine, a way to look deep inside the living body in beautiful detail and with no radiation at all. The fear tends to melt the moment you understand it. A magnet, some radio waves, and a great deal of patience. So let's put it all on one calm page. First, which scan? For which question? Picture two doors. Behind one, the CT, fast, for bone, for bleeding, for the emergency. Behind the other, the MRI, slow, for soft tissue, the brain, the spine, the joints, and no radiation. Then, the report words that frighten people, gently translated. A disc bulge in a back with no pain, usually just your age written down. Signal change or a small spot. Most often, watch and repeat, not alarm. Of uncertain significance, doctor. Speak for, we'll keep an eye on it. And finally, before any MRI, ask the one question that protects you, in three simple parts. Is there a clear reason for this scan? Will the result change the plan? And since an MRI is costly and slow, is it truly the right test for this question? So what does the finding on that report actually change? Usually, far less than the frightening word suggests. A small spot, a bulging disc, something the report calls of uncertain significance. Most often, that simply means watch it or repeat the scan in time to be sure. A clearly serious finding opens a clear path. 1. Your doctor walks beside you, step by step, but the golden rule never changes. The picture is always read together with your symptoms and your story. A frightening word on a scan is the beginning of a conversation with your doctor. It is never a diagnosis. You hand yourself, alone, at midnight. So when is an MRI truly the right call? When there's a real question whose answer will change what your doctor does. Persistent nerve pain, weakness or numbness. A joint that simply won't heal, following a known condition in the brain or the spine. Those are scans well worth having. What deserves a pause is the full body scan booked when you have no symptoms and no specific question to answer. And a few honest words about the test itself. An MRI is brilliant, but it is not all. Seeing and a normal scan, while reassuring, can never be an absolute guarantee. None of which means avoiding one you genuinely need. When the question is real, the MRI that answers it is exactly the right choice. So, the whole thing, in one breath. An MRI is a magnet and a radio wave that map your soft tissue in beautiful detail, with no radiation at all. It is unmatched for the brain, the spine, and the joints. A partner to the CT scan, never a rival. The metal questions matter, the dye is generally very safe, and the scan to gently question is the full body package with no real reason behind it. And above all, because a scan this detailed finds something in almost everyone. A finding is not a diagnosis until it's read with your doctor. If you'd like all of this on one clean page, which scan for which question, the report words decoded, and the 3 questions to ask, just comment the word honest, and I'll send you the free 1-page MRI decoder. If this made the idea of an MRI feel a good deal less frightening, do consider subscribing. Because that is the whole point of this channel. Your blood, your heart, your scans, no single test is ever the whole story, and we are making sense of them one at a time. We take the things that frighten you in a medical report and we make them make sense. Sushruti, worth knowing. One last thing, and it matters. This video is general information, not medical advice, and it is not a substitute for your own doctor. Whether you need a scan and what your scan results mean is a decision for a qualified professional who knows your history. So if something is affecting how you feel, and above all, if it is an emergency, please don't wait. See a doctor or call your local emergency number.